Hello, I am Dr. Veerendra Koujalagi. I am medical gastroenterologist practicing in Sahakar Nagar, Bengaluru at my clinic Eka Gastro and Liver Care. Constipation is also a subjective feeling when actually you would be passing normal amount of stools, but you may think that there is constipation. And also the amount of water that is adequate varies with weather, activity and other variables. So you may be feeling that you are taking adequate amount of water, but it depends on what activity you are doing, how is the sun, how is the weather and humidity. So lot of factors count when the amount of water intake has to be determined. And also fiber depends upon what kind of fiber that you are taking and what is the amount. Ideally we require 20 gram of fiber, although Indian food is rich in fibers, but sometimes if you are taking something like white rice which is devoid of most of the fiber, or items which are prepared from flour like maida, then there could be a deficiency of fiber. So we have to make sure that we are meeting that goal of fiber intake and water. So this is one of the common misconceptions where you are already thinking that you have adequate amount of water and fiber, but it may be running short of the required amount. There are numerous causes that can cause chronic constipation. The most common is again impaired intake of water and fiber in the diet. But also we have to take into account that physical activity, if somebody is very sedentary, then the bowel movement can become impaired and there can be a constipation because of slow transit. And one of the most common causes that affects is diabetes. So in long-standing diabetes patients, there can be an impaired movement of the bowel called as neuropathy, because the nerves themselves supply the large intestine which has to move whenever these nerve impulses come. So an impaired nerve functioning in diabetic autonomic neuropathy can cause chronic constipation. And also there are multiple other conditions where people have congenitally slow moving colon. So they also tend to have chronic constipation. And many times undiagnosed thyroid disease is a common cause of chronic constipation. So patients with hypothyroidism who are not getting treated adequately or not being diagnosed can have chronic constipation. So these are common factors that result in constipation. According to several guidelines and gastrointestinal societies, so what we usually think is daily at the same time, same amount of bowel movement has to happen, the stool has to be passed. But in reality, it is very far from true. So some people can pass daily 2 to 3 times, which is again normal when the consistency is fine, and it can also be once in 3 days. So anywhere between 3 times a day to once in 3 days is normal. So it really varies from person to person and how individual system is designed. Laxatives come in varied forms. So some of the laxatives are simple, they soften the stools and they help in passing the stools which are hardened. So they do not usually cause long-term implications, but there are many laxatives which are irritant, that is they stimulate the colon and cause irritation and hence the bowel movement. So such laxatives which are irritant, especially the one which is commonly used, senna, or which we commonly utilize in daily intake by many people who are chronically constipated, which contains this senna, tend to overstimulate the gut and will cause structural changes in the large intestine. So chronic use of such medications has to be avoided, but stool softeners are fine. So as we have discussed about constipation, are we to be really worried about constipation all the time when it faces? No, we have seen that constipation can be because of simple causes like hypothyroidism, fiber intake or impaired water intake also. So when we correct all these factors and still there is constipation, or whenever the constipation is associated with blood in stools, weight loss, loss of appetite, or there is a difficulty in passing the stools and there are small caliber stools that are being passed, then we should be very serious about it. It can be because of colonic cancer, especially in elderly and in men. So we need to look out for these symptoms whenever there is constipation.